Hello, hello, hello. Welcome to another episode of High in the City. I'm not even going to do that to y'all with the noise because you guys are wearing
You
headphones.
try that, please.
Welcome to another episode. And, do we need to do introductions at this point?
No.
Hot
We're
boys and
family.
girls, do we need introductions?
Hot boys and
Let me stop. No, let me do the introductions too. Let me be.
yeah.
If you don't know us by now, I don't know what to tell you. But anyways, Majan over here, Lika over here,
TV.
and we have a special guest, Fatoumatta. And we have Fatima over here. Hannah will be joining us later.
Yes.
So, if you cannot tell by now with this pinky, we're talking about breast cancer. God forbid, I'm not laughing at that.
Yes, just laughing at the pink. The color.
Anyways,
Respect yourself.
so sorry. So today I feel like we're talking about something that affects millions of people around the world, well, specifically women, which is breast cancer. So we're gonna explore what it is, why early detection matters, and how we can play a part in supporting awareness. So, Fatoumatta, if you can briefly introduce yourself to the audience.
All right. Thank you for having me. My name is Dr. Fatoumatta Jitteh. I am currently working at the Department of Family Medicine. I also double as the Development Director of Solis Foundation.
Oh, that's nice. You have a nice voice.
No, thank you.
Hello, family. My name is.
So,
You need to learn. Oh. You're very.
me. See, the voice is nice, it's soft, it's sweet. Me, wah, that's all you.
Out here shouting like this. But it's
So
okay.
to begin, if you don't mind explaining to us, what is the simplest way to explain what breast cancer is to someone who has no medical background?
All right. So basically, the breast is the organ that we have on our chest. Men and women have breasts, but men deny that they have breasts. So
I have chest.
because they have chest, so
Yes.
when they have breast cancer, we call it chest cancer.
Yes, true.
Yeah, so basically it's the cells in the breast. The breast has cells, you have fats, you have ducts and lobules. So if the cells in the breast, a group of cells decide that, okay, now we're not going to follow the normal regulation, then they outgrow themselves. Everything that has a beginning must have an end.
Yeah.
So the cells in cancer basically refuse to have an end.
So just keep.
So they keep multiplying.
Multiplying.
The body is supposed to regulate everything, including red blood cells. They all die, and then new ones are born. So that's how we age.
Yeah.
Some die, the
Yeah,
skin changes,
yeah.
every part, every cell in the body has to die. So in cancer, they just refuse to die.
Hey.
So that's how they become cancerous, essentially. That
They're
they
growing
keep
out of
growing.
control. And then they grow to the extent that they leave the organ they start in. In breast cancer, they start in the breast and then they eventually grow out of the breast and go to the
somewhere
other
else.
parts of the
That's
body. So it's just when
crazy.
there's no regulation, there's a team of cells saying, okay, you need to gluten-free, there's no control over here. We're going to do what we're going to do. Yeah, right.
Dang, that's crazy. So I wanted to know, are there any specific risk factors that people should know about, if it's genetics, lifestyle, etc.?
So basically, we still don't know the exact cause of breast cancer. That's the other problem. So we don't know, we don't have a vaccine yet or anything. So we talk about risk factors. We talk about those that you can do something about and those you cannot do much about. So the modifiable and the non-modifiable risk factors.
Okay.
So modifiable would be something that you can change, things that you can alter. Let's say smoking. Yeah, you can stop smoking. Alcohol, that's another modifiable risk factor. Exercise. That's
I'm looking at them. You are hearing her. Continue.
Yeah, so diet, exercise, smoking, alcohol. Those are things that you can do something. And also having your child earlier.
Baku.
You see us?
Yeah.
So I have a question. When you say smoking, does vaping, is it vaping or vaping?
Vaping.
Vaping classify?
Yes, it does.
It's
Because
smoke.
it's part of it.
That one is nicotine, and I don't even know what else they be
You don't
mixing
even.
there.
I'm telling
I
you,
don't
we're
be
just
buying that.
inhaling and exhaling that smoke. Puppet.
Okay.
It's all part of smoking.
That's interesting.
Yeah. So the modifiable things are the ones we target with advocacy. We're like, okay, let's change these things, and then we can do something. So we know that breastfeeding can provide some sort of protection. Like women that breastfeed lower their risk of getting breast cancer. Also, women that get pregnant earlier. like 20. We're not talking about early marriage,
Yeah,
but this is 2025. Early marriage is now 20, 21, 22, 23.
Facts. You'll be like, teen marriage. This is a child bride, and it's a whole 25-year-old.
Right.
So I do understand.
So things have changed
Yeah.
a lot
Yeah.
from what we used to know as early marriage. When I
Marriage,
talk to patients, I say, try and get married early, and the patient is like 28 years old. Try and get married. So it's
At that point,
Gang.
At that point,
so
it's not I mean. I mean, she.
so the advantage of getting your child early or getting married or getting a child earlier is that
linked to the
you
breastfeeding.
can basically, not just that, you
just
can
that, yeah.
also get your children earlier. Let's say if you're going to get breast cancer at 32 and you already have 3 kids. That's a big advantage for you.
Interesting.
Considering, let's say if you're 32 and you're newly diagnosed with breast cancer, you're not married, no child.
So you better adopt.
So she's saying now,
makes
like,
it-
was women, older women basically are at a high risk of getting cancer.
Yes, all cancers.
So
The
what do
older
you,
get.
when you say older, like,
What's the age range?
Where do we draw the line?
What's the minimum age
we want to know, like,
that
when you
counts
say
as older?
The thing is, all over the world, women, the other countries are talking about women starting screening at 40, at 50. In the Gambia, we're seeing 25-year-olds getting breast cancer. So our reality is a bit different.
It's a bit different,
And we need to start speaking and acting differently. Initially, when a 23-year-old, when I was going to medical school, when a 23-year-old presents with a lump, we were like, okay, it's benign, it's nothing.
Oh, she's just 23,
Yeah, 23.
yeah.
They like, because usually the lumps that present in younger women are not cancerous. So you're like, okay, it's a child,
Yeah,
but
yeah.
now we are not doing that
No,
anymore.
you can't take that
a lump
risk.
is a lump.
The
you gotta look
message
into it.
is every lump should be checked
Yeah.
by a healthcare worker. And then it's not just to do a physical examination, is to go and do the second stage, second and third stage, meaning you do ultrasound,
Okay.
you do a fine needle aspiration, meaning we go take a needle, put it in the breast, in the lump. It doesn't have that much.
I felt
Just
kind-
inside the lump
felt
and
the
just
chill.
take a tissue out and confirm if it's cancer or not.
Okay.
So every lump should be checked.
should be checked.
Except the little exceptions, of course, are like breast when you have abscesses. So when the healthcare worker sees it, usually they know it's an abscess. They drain, give antibiotics, and then
And that's
it
it.
goes away. So those ones are usually easily treated. Those are not the issues. It's those lumps that are not affected, associated with maybe fever or any accumulation of So
Okay. Oh, sorry. I have a question. How has the advocacy been in the rural Gambia? And also, what would you say is the best age as a woman or even a guy to go and check for, like, do the screening and all that?
Yeah. So, rural Gambia, I think we recognize that those that are in this region are doing better. Like the awareness, everybody is shouting around this end, and then over there we're leaving those women that have maybe not gone through formal education. We're leaving them behind.
Yeah.
So that's part of the mission of our foundation, to go and reach out to those ones and say, these are the signs and symptoms of breast cancer. These are the risk factors you need to look out for. And this is what you need to do to screen. So in those efforts this year, we were able to go throughout the country and teach healthcare workers. We cannot teach all the women,
people.
but the healthcare workers, the centers they go through. We don't want a healthcare worker to see a patient with a breast symptom and then they dismiss it off as something that is.
Something that's benign,
So
yeah.
we were able to train up to 290 healthcare workers all over the country.
Wow.
That helps. It helps. It's not
impressive.
the only solution,
Yeah,
but it does help a lot.
something, yeah.
And we have seen that some of them still call and say, I have this patient, what should I do? Can I refer to? And we're like, yes, go ahead and refer to the clinic. So it did help, and it's a step forward.
So, like, how often should a person know? Let's say the woman or the man go for screening.
Yeah, how often
basically.
She did ask about the age, and like I said, we have a different reality. And we cannot say wait till 40 and start screening. That's haram.
That's late. That's late.
That's late.
That would be
Whatever is
illegal.
happening,
Yes.
the cancer would
No.
already
Yeah.
fuck you up.
Yeah, so
that's
in advanced countries, they're actually
Yeah.
starting at 40, 50
Okay,
to screen.
advanced,
But
okay.
us, I think we need to start a lot earlier. Like as long as the girl is a teenager, 16, 17, we need to
Upwards,
start
yeah.
Be on
talking
the
to her
safer side,
about
huh?
to
On the
know,
safer side.
at least let her know how to do
Okay.
a self-breast examination.
Okay. So I feel like you often often hear people say it doesn't run in my family. How true is that? That they're safe? How true is
The
that?
thing is, in a setting, somebody can have something and nobody in the family knows. It's even improving now and with the awareness, but
Yeah.
somebody can literally die of a disease and the family members, they don't know. Even the escorts that take the patient to the hospital, you ask them, they're like, we don't it's
know.
now that it's changing
It's
a
changing.
bit.
Yeah.
So
yeah.
to say that I don't have family history of breast cancer, that would be a very bold statement.
Bold statement,
So what
yeah,
you
that's
say is I don't have any known family history of breast cancer.
You don't even know.
You
all
don't
you
really
have.
don't know.
So you're
Because I
thinking
feel like
everything is
the
okay, not
problem
knowing.
here is that, at least what I've seen, is that not everybody goes to do like a yearly physical. So you won't even be able to see itself. Is when you realize, oh, actually, I feel like crap, for example, and let me go to then that's where they tell you, you have hypertension,
The thing is, it's not even
diabetes.
physical, sir, because most of the time you're just going to check for malaria.
Yeah.
That's the only thing you're going
That's
to
the only
check.
thing. So they don't
Yes.
actually
they
go
exactly
to just do a
this.
full physical, the blood count,
I
all of
think
that
Maria
stuff.
got somewhat lucky. Like
Yeah.
people now are not even checking. They're just going and starting the quantum diagnosing themselves and just going ahead.
They've made it easier for us now. I feel like
People on ChatGPT,
we have been to, I feel like malaria and Gambians, we have been like this since
5 and 6.
Since,
Five
since
and 6.
chloroquine days. So we know how to treat it now. You have slight, you say malaria.
Malaria, yo.
It's
No,
most
you're
of
right.
the time, it's 100%. As soon as you
No,
go to
you're
the
right.
pharmacy, you know, like, I'm malaria, wait for a minute. You know. So you start prescribing, you start drinking all these things. So, boom, mom.
you're right.
If
You're
they were
right.
nursing school, boom, boom. Yeah. This is we have it locked in with that, to be honest.
good.
Boom, boom. Yeah.
So we were talking about like the early detection and then the minimum age and stuff. So I wanted to know, like, how early, like when you're doing like the check, how early can it be detected, and then what are the chances of recovery, like once you find it early?
Yeah, so you can have a lump and not be able to palpate it. Sometimes if it's so small, it's starting. But with cancer, it's going to grow. It's not going to stay. If it was staying small, it's okay. It will stay like it, but it would grow. So when it grows, that's when you are able to palpate it. It has to get to a certain centimeter. Because if it's starting,
Like
it's
this.
just going to be tiny. You're going to
Yeah.
think that it's part of the
yeah.
breast.
Interesting.
So the unfortunate bit is it's usually not painful. So we are praying to the Lord to make breast lumps painful so everybody can just rush.
Just go, yeah.
Right.
That's true.
I wish it was painful
I do
agree
because
with you.
early
Because
diagnosis
like,
would
yeah,
have been
you
a
just be
thing.
like, oh, okay, like this is a lump. Oh, yeah, like it's
Because
not
we made
going
it
to.
with chukulni sometimes. You don't
Thank
understand
you, and that's
the-
what I'm
the si-
saying.
Yeah.
Because people will wait until they're in a lot of pain, then they go. That, like I said, that's when you go and discover you had 10,000 things
That's the
going on
time
in
I
your
drag
blood.
myself to the hospital.
Since this episode is more of awareness raising, you made mention of something like ultrasound, biopsy.
Oh yeah, I was even
PE,
about
and
to ask.
So I just wanted to confirm: is there any difference between the mammogram? Is it mammogram?
Mammogram, yeah.
Ultrasound and biopsy. Like, what is the difference?
Yeah, so biopsy is the histopathology. That's lab.
Okay.
Yeah, so you have radiology and then you have lab.
Okay.
So you have to do radiology and you have to do lab. It's different. So it's a clinical breast examination, which is usually done by a healthcare worker. And then radiology, which is either ultrasound or MRI or mammograph. And then histopathology is the definitive. It's almost 100%. If they say is this, that's it.
Okay.
Interesting.
get
So
it.
yeah.
Thank
So
you.
here in Gambia, what are the screening methods that exist? Like, for example, the mammograms, the clinical exams or whatever. Like, not only that, but also like, I guess I've seen a lot of like self exams and things like that. So what screening methods would you I guess suggest, and what are actually available like here?
Okay, so because we are low, and I don't know if I should add it middle, but we're part of the low and middle income countries. It would be crazy to say everybody should use a mammogram because
That'd
we
be crazy.
cannot
We cannot
afford
do that.
We don't even have enough mammograms for that. So we only request the mammograms to special groups, like you're maybe above 40 and you have a family history, and then we want to really go because the mammogram can see what like more specific details than what the ultrasound can see. But for usually the general population, it's ultrasound. You do a clinical breast exam because the clinical breast exams also tells you, it gives you a clue. For experienced doctors like Dr. Jitteh, he can just have a strong clinical suspicion that this is likely, especially in advanced cases. That one more.
As soon as you see, you know.
Yeah, you can have a strong clinical suspicion, and this is malignant.
This is what's going. Okay. So we did ask how often does she get screened. So would that also, like, if, for example, for me, if I'm going to do my physical like once a year, would that be a good amount, like once a year for me to go?
So once a year for a
screened?
healthcare worker to screen you, that's great.
Yeah.
But for individuals, you can do the self-breast examination,
Oh,
which
so
we advise.
How do
monthly.
we? I know they're going to ask.
It's
How do we do
monthly.
it? I can show a demo. I don't mind. We're talking about movies.
Usually, the recommendation is to do it at least once a month.
At least once a month. Okay.
Yes. So that you can have a good idea what your breasts feel like.
So how do you do it? Do you just?
So basically, you start one breast at a time.
Okay.
You need to.
One at a time.
Preferably, you can start with inspection. You stand in front of a
the
mirror.
Okay.
Yes, with your hands down.
You heard them.
And,
First step, mirror. Check.
Yes. So you check, and what you're looking for is any hands down 1st, and then later you can raise your hands to see.
Oh,
So you just stand first
interesting.
and see. Look at the skin of the breast.
Okay.
Start with the skin. Look for any changes in the skin.
Okay.
Are you seeing
Discoloration,
patches of
patches.
yes?
Sagginess.
It's like
and stuff like that.
First of all, the sagginess is gravity. Okay, the skin.
Yeah,
Okay,
the skin
to check so that nothing is
discoloration.
off.
Yeah, so sometimes we call the skin pure orange.
Okay.
Meaning it looks like the back of an orange peel, like those. You know, the skin already has.
Interesting. Yeah. Has
So it goes in deeper with breast cancer.
Okay.
Yeah, so it has the skin looks like it comes from French pure orange.
Yeah.
Is the part of the nipple, like the breast, that is black?
Like that,
It's the skin itself.
Just the skin itself.
The breast skin itself has already has pores. So those pores will go in deeper.
more visible.
And then it would look like the orange. When when you look at the orange cover,
For the cover, how it
especially
looks,
the orange, the imported orange. Yeah, so you can see that the pores are more visible. Yeah, so you look for that. You look for skin changes, any discoloration in the skin. You look for visible lumps. Sometimes you can see a bump in the breast.
Okay.
Yeah, hopefully not, because usually it's usually a big lump.
Yeah.
And then you can raise your hands and also see. Sometimes skin puckering, like some part of the skin is going in, and then you can look at the nipple. So you look at the nipple area, that's the dark part of the breast. Yes, you check for any nipple inversion.
Yeah.
Is your nipple out or in? Usually, some women have normal nipples that are inside, like a flat.
No, for real, I gotta go home and really be like,
I have to go to the mirror because
let me
tell
check
me
this
why
out
I've
again.
lived, I've never.
Yeah.
So
do
some
something.
women do
started
have
19,
natural
20.
nipple inversions.
Yeah.
Sometimes when they're even breastfeeding, we have to teach them how to bring those ones up. Some have flat nipples, some have
Wait, how do you even? How do you? That's cute. This is a whole sidebar. How do you for them to like breastfeed if your nipple like is inverted?
like usually it's not all the way in like
okay.
like
yeah,
a hole.
That'd
no.
be crazy.
It's like flat. Like,
No,
very, like,
They're
that'd be
usually
crazy.
flat. So
Yeah.
it's during the antenatal that you teach them how to you stimulate it basically. So it can-
Interesting.
So what happens if a person has like a tiny nipple?
So basically, the size of the nipple would not really matter. What you want to look for is any ulcers, skin ulcers around the nipple, not or anything.
Okay.
And also you press the nipple and see.
That one is painful.
You're checking to see if you're going to see something.
Okay.
What-
If something will come
Like
out
what
and stuff
do you
like
think
that.
would come out and you suspect cancer? What?
Imagine.
Just imagine. What do you think?
Yeah, you
would-
don't have kids or nothing. You just believe something is coming.
Okay, if for somebody that has never been pregnant and has never breastfed before, you're not supposed to see milk.
Imagine. What do you
Yes,
even
like,
say at that
because
point? Just
some
do this.
people don't have babies, but they maybe had one pregnancy that they lost.
Yeah.
Yes.
Yeah.
So usually the
Okay,
body
and then the
already
body's
starts
already-
preparing for breastfeeding. So that would not necessarily count. I had a patient once who came like, oh, madam, like so worried. I'm like, but I had to sit down and take a moment. And it was later I realized, have you been pregnant before? And then she said yes. I'm like, okay.
You almost got me.
Yeah. Right.
Don't leave out these information.
For
They're very vital.
real. And I wanted to know what are the warning signs that should never be ignored?
A breast lump is the
Just
most
the
common.
lump. That's the most
Is the
common.
most common. And then you shouldn't see blood in the nipples, whether you're from the nipples, whether you're breastfeeding or not. You should not see
That'd be
blood.
crazy.
bloody. The nipple discharge is one of the.
Do you feel like pains or anything?
Yeah,
of the
usually the
sort?
pain comes when it's advanced. So
So,
the lump would pain in advanced stages.
By that time, you're like,
That's
what? I'm
when you're
dead.
not.
Like, make
That's
your
when they
arrangements.
usually come to the hospital when it starts getting bad or the skin has an ulcer now. Because imagine like this is the breast and then there's this lump here that's growing. Lump feeling like
Many picture body.
growing. They're growing in all sides,
Yeah.
and then they will eventually come to the skin. So if they come to the skin, they're still growing. What
they're
do you
still
think will
growing.
happen? The
Yeah.
skin would open up, and then
It's
sometimes
gonna
they
be
have
very
skin
irritating
ulcers,
and stuff like that.
like a wound on the breast.
Lord have mercy.
Just, I don't know how y'all do it. Honestly, mad respect to you doctors, because me, first day I'm fainting.
So,
like this.
No.
about the lump growing and coming in or out of the skin, does it apply to men as well?
A man with a breast lump is more urgent than a female with a breast lump.
Because I feel like theirs will show more quickly
Will be
because
more.
they don't have all these things.
But then again,
protecting
you know what I'm thinking? You know the men that
That's
be jacked.
chest.
It's
Like,
hard to
how
tell.
is it- yeah,
how would you
well,
even
but-
tell with those men that are already got like C cups already? Sorry.
Yeah, so when a man has a breast lump and the woman has a breast lump, a woman usually, it's full.
Yeah.
Yeah,
So
it takes
the
time.
lump has a lot of room to grow first before it goes
Goes
out.
out, yeah, okay.
But the man doesn't usually
Doesn't
have
have that,
So
that's
when they
true.
have that lump, usually they are more shy to come and say, I have something in
I beg, you're
So they're
dying.
quiet
Don't be
about
shy,
it.
yo. Go and get him.
So
Something
they're
that has not
quiet
been
about
part of
it.
you, all of a sudden
All
it's
of a
showing
sudden,
and you say you're shy.
You have to go. You people, man, I beg you.
Please.
If you see something is going on, it's not go. It's more urgent to us. At least some people can waste small time before they. But you, man, I
Yeah,
beg.
so a woman would have more time for it to grow in the breast. But when you put 100 women that have breast cancer, 100 patients, only one man would have breast cancer.
So it's not like really on
Mainly
their
a
side.
woman thing. So it's
Yeah.
1 in 1,000 men.
Men, go and screen and test yourself.
Screen,
Just
don't be
because they say
shy.
1 in 1,000 men doesn't mean that
Imagine,
you should not be screening.
You know what I'm just. You know what
You
I'm
should be
just
doing
thinking.
this too as well. You know,
Exactly.
checking.
You know what I'm saying?
You should.
Because you know what would be crazy? Once you die from that, God forbid, but as a man, let's say you have it, whatever. What are you going to put on your headboard, on the tombstone? Or he was too
died
shy.
because of breast
he was
cancer or
shy to
chest
go
cancer.
and get tested. Preventable death, though, to go and go check. Here lies the man that was too shy to go and, sorry, that'd be
Okay, I
messed
think
up.
so. I think a lot of things that happen to us as humans, it's usually normal, and it's just the body showing you that it is functional at some point, and it's not functional.
Yeah.
So this question I'm asking, it's with regards to treatments or operations
I
with
was literally about to even go into
Yo.
that. Correct. Let's
Yes.
segue. Let's
So-
segue.
So sometimes even with fibroids, sometimes when they have like operations, it comes back again. So does the same process happen with breast cancer? Like once there is a successful operation, is there any chances of it occurring again? Knocking
yes.
at it.
Just thinking, how's she
Yes,
gonna
yes.
let us know?
Yeah, so it
That's
can
crazy.
reoccur. If you have breast cancer, you're likely to get it again. You're more likely to get it again than someone that has never had
Yeah.
breast cancer.
Oh shit.
Badass. Not bad. It's not good.
So the thing is, it's
God.
1 in 8 women. In a lifetime, let's say you put 8, how many women are in this room?
1, 2, 3, 4, 5. It's 2, 4, 6 of us.
Yeah, so you need 2 more for
Two
one.
more. One.
Statistically, obviously,
Yeah,
statistically, it doesn't
yeah.
mean that any, but
Yeah.
statistically,
Yeah.
like you have 1 out of 8 that would be diagnosed in her lifetime. Like this is not the end of our lifetime.
Yeah,
Let's
yeah.
say we're on average we're age, let's say 30.
Yeah.
And then some are going to go to 90, some are going to go, that's your whole lifetime.
That's your whole
so
life, that's
during
true.
the lifetime of a woman, 1 out of 8
Yeah.
women would be diagnosed.
Diagnosed. Yeah. Okay. So, can you give us an overview of how it would be treated here in the Gambia?
Yeah. So what we do have at least the first, you can diagnose it here. You can start treatment here.
Yeah.
You can do the surgeries here.
Okay.
Especially if it's early.
It was early.
Easier.
Yeah. That's
so
true.
the breast cancer is a whole group of cancers too. There are different types of breast cancer. Depending on the type, that would inform the type of treatment you're going to receive as well. Yeah, but generally you do surgery, you do chemotherapy, you do radio. We don't do radio, but we can do chemo here, and then we can do surgeries. Especially surgery.
The surgery,
that part is good.
They got it. Yeah, we got
it.
surgeons here.
They're doing
good.
well. Actually doing well.
Yeah. So okay. I wanted to know what are the side effects that patients should expect, and how could they manage them with the treatment and things like that.
Okay, so that's the whole point of the advocacy. We want women to come early so that we can detect it early, so that the treatment can be a bit easier. Yes, because how you would treat someone that has maybe stage 1 breast cancer and another person with stage 4, it's not the same.
Stage 4 is the highest one, right?
Yes.
Wow.
So stage 4 is when it has metastasized, meaning it has gone to some other organs that are not the breast.
So what are the names of the stages?
Yeah, 1, 2, 3, 4.
They're just 1, 2, 3, 4. You just tell them,
It tells you the level it is at.
how severe it is.
So if it's stage 4, that is metastasis, meaning it has left the breast, traveled through the blood or the lymph, and gone to the brain, or the liver, or the bone, or the lungs.
So what does it do to the body when it goes to that stage?
Yeah, so imagine like you have a lump in a breast, and all of a sudden that same cancer cells. It's not like the lump moves. No.
Whoa, wouldn't that be crazy? Today you wake up, it's on your breast. Tomorrow it's on your back.
What's going on? Like, I know.
That'd be great. See.
Yeah, so it's like you have a group, and then some family members
who are leaving. They say no, we want to explore the body. And you then check other side of the
That's crazy. So it goes into like your
like through the lymph or the blood. It can go and seed in another organ. So if it's the brain, you cannot start saying, okay, I'm going to do breast surgery and maybe remove your breast and then remove the breast. You can't. It can't work that way.
So imagine, not only is breast cancer, you can also
Cancer
have other
is
cancer
indeed
like
Yes. I agree with that.
Now that you said it, bro, with all the explanation,
No, I
all
didn't
that I
realize
know,
it could go that far.
I'm about to be checking myself every
day.
That's the whole point of the advocacy. So women can come early. If they come early, you just do a lumpectomy and remove the lump and leave the breast. Yeah, and then they can do chemo and somewhat radiotherapy sometimes. But if you come late, and it has gone to the other parts of the body, you still lose the breast, and then you will not still get cure. So that's the problem. Because
with the advocacy side, like how is it going on? Like, have you guys seen improvement? Are the ladies coming in early, like to come and check, or is it like still with the struggle of them having to wait until it's like on stage 4 and then they start coming in?
So the last time we checked was the statistics was last year. You had an average of stage 3 and 4, and that was like the average stage 3. Yes. So stage 3 is when distal nearby organs, when it's touching maybe the lymph nodes, and that's part of the self breast examination. You have to raise your hand. I saw that you were raising your hand.
This year we are raising the hand.
I'm shocked at this one. She's shook it.
This year we are raising the hand. Let's raise it together, man. We got to do something.
We have to. Oh my
so
goodness.
when you raise your hand, this hand, let's say the right hand, should examine the
left breast.
Yes. The left breast. And then don't forget the armpits, because that's the first place the lump is going to likely go to.
Me, I'll be having flare-ups because I have this condition that's like, I forgot, it's HS. It was like one of my friends that diagnosed it, one of my nurse friends. Shout out to you. So now when I have a lump like this, hey, God, you people.
Yeah, so it's just to make sure that you don't forget that part of you need to check on the armpit and make sure you're not palpating any lumps as well.
Hey.
So when these women come in with the stage 3 and 4, like is it like emergency treatment? Like how fast? Because stage 4 is
So even with stage 4, you can still get some treatment, and some women, like the response is not the same. A woman can respond very well to chemotherapy, and the cells are young, and they're literally listening to the chemotherapy and trying to curtail their movement. So you can have someone come to in stage 4 and still be relatively okay. You can have someone in stage 3 or 2, and then, it's not responding too well. So it's a whole group of diseases. But obviously, you cannot count on being lucky in stage 4. That's why the earlier you come, the better it is.
So when you say, like, when they don't respond to, like, treatment, how does that look like?
Yeah, sometimes they change the therapy depending on what, again, because the types of cancer, like I said, it's it's different. It can be hormone positive or not. And there's a whole classification on the types and which treatment best works for them. So when it doesn't work, sometimes they can change the treatment and try something else. But honestly, we don't want women to go through those things. Because you started, I think the question was on side effects.
The side effects, yes.
Chemotherapy, they're very powerful drugs. Usually they're not selective. They're not going to go into the body and be like, I'm going to the breast only. I wish they were doing
Isn't that why
that.
like people's hair be falling out?
Yes.
Oh god.
So it affects all, if not all, most fast-growing cells. So what are the fast-growing cells in your body? It's the hair follicles.
The hair follicles, yeah, that's true.
Supposed to be fast, but I don't know what is happening.
On my side, it's
My
not fast.
side, we just thank God for the locks because if not, you people, my hair will be here.
My own is just okay, man.
It's
just doing its
wow.
job.
So that makes sense though, like
Now
because you know how like in
so-
the movies you be seeing like, oh, I just started chemotherapy, and then you're
It's
seeing the
falling.
hair.
They're pulling hair,
They're pulling the hair, so
right.
they have the scarf. I
yeah.
did not realize that.
So it's the hair. Most people
Yeah.
go bald, like bald.
So they were just shaving their head like this
Because,
once they get diagnosed.
A chunk has
Left already. So
the
might as well.
reason why some shave before it gets there is because at least you feel like you're in control. You're the one cutting your
having to-
hair.
yeah.
Imagine you're doing washing and then one chunk that can just
shouting.
pull your heart out. That's difficult.
That would traumatize you too.
That is
would.
difficult.
It will put your
Because I
brain
feel like
on
it's like a physical reminder, like, yo,
Right.
I'm going through,
Right.
you know?
And women, we love our hair, we love our skin. And those are the things that it goes after, your nails.
Oh Lord.
So the nails will get dark and
beg.
you can get infections under your nails as well. Yeah.
That's crazy.
So the skin can change as well because it's a fast growing cell. And the
Yeah.
other thing is the gut. So diarrheas are common or pain,
So
terminal
not
pain.
only are you
Like
going
lack of
through the
appetite, 'cause
cancer,
I feel like most of the time they're
the
very
nausea
like skinny.
is the nausea. Yes.
so not only are you going through this cancer,
The
so the
chemotherapy
treatment is
hard.
what is making you go through some more
Yes, the
things.
chemotherapy. It's not the cancer that takes your hair off.
No, I'm saying like you're already dealing with like the
cancer itself.
The cancer
Now-
itself,
Yeah,
the
like
trauma
wow,
of
the
the
trauma of actually being,
diagnosis.
you
Yes.
know, and then now you're doing the treatment.
Yeah. So
It's a whole nother ball game.
it is difficult. That's why the support is important. That's why we don't cry in breast October. We celebrate because we know that women need that support to feel like they're still part of that community and there's a community out there to support them. We wear pink, we have fun, we are saying celebrating breast cancer.
Yeah.
There is no other illness we are doing that for. We're not celebrating malaria.
That's that one, mom.
That's right.
So we wear pink, we have fun, we try to make sure that
Raise awareness, do fundraising, things like that.
So after like the chemotherapy and stuff, like do you like get back all these things? Like if you start taking, maybe like supplements and something, maybe get the hair back, nails, skin, maybe try to look confident again.
Yes, your skin would come back gradually. Some people go dark. Like your skin color, you're brown right now. It literally can be
The ones that
Nutella.
hate dark skin,
So
that
my-
one they would be crying.
The way I'm pissed when I'm using like a soap and the next minute I'm seeing like my face is giving me, different colors, one people. Hey! The way so imagine if you have to go through that, you're seeing yourself in like it's like
You
you're
don't
in
recognize
another
yourself.
body, basically.
Exactly. You
It's
can't
like, who
recognize
is this?
yourself.
But that alone is
So with the
It's a
nausea and
traumatic
stuff,
experience.
is that why people be losing like so much
Yeah,
weight
the
and
weight
stuff?
has a lot of combinations
Yeah.
because, like I said, you're losing the gut is also shedding a lot. You're having diarrhea, you're having nausea, you're not eating well. So there's the weight loss is just a combination of a lot of stress. You're going through stress,
Yeah.
and then those drugs, like I said, they're not having mercy on you. Yeah. So
these women are strong. You people are strong.
So I wanted to know, you know how we always talk about like right now we're talking about like the treatment and stuff like that. So I wanted to talk about like life after the treatment, like what from your like
post-treatment?
experience. Yeah. What have you seen like the journey for the survivors?
yeah. So survivorship is a whole big wall of its own.
Yeah.
So women go through chemotherapy. I don't think anybody comes out the same.
Yeah, definitely.
The way you're going to go into that, you're
Yeah.
gonna, you're
And I
gonna
think you're
come
also
back.
confronting like your mortality as well. And I think that can be
Because a
it's
lot
like,
of times I do think it does feel like that, but you come out a different person.
Yeah,
And
yeah.
if you use it positively, that could be,
yeah.
that could be a game changer because women have gone through it and come out and done stuff that they would have never done.
Before.
Yeah. So some do come out of it warriors. Like they're tough, they're going for it, they're facing the struggle because you imagine everybody knows you're brown and then you come out
Gambia.
and then you're like
They will be
The
mocking
thing is,
you.
I feel like
They will start.
especially in this country, they don't. I feel like they don't know the question to ask.
Yes.
They don't know where to ask
Yes.
it and how.
Exactly.
Like, okay, I was light skinned and all of a sudden I'm
got
dark.
that.
The thing
You
is,
don't know what I'm going through.
What?
You
Thank
look at
you.
me, Lenny.
a lot of people in this country
crazy.
are very judgmental.
Very judgmental.
And the fact that this is one reason why a lot of people are doing things that they're not supposed to do. At the end of the day, it will put their lives at risk.
yeah.
And we are not even asking the necessary questions or what is the problem is
you
what
okay?
problem is actually happening
Thank
or
you.
why is this and that and that. You're just saying person and be like, hey, whole colleague, Hannah done hair, sir.
That, and even with the
beard
weight
makes,
loss,
I
so
wouldn't
yeah.
really mind, but it's the fact that because I have a friend, I think he was going through stuff. So at some point, I've done anyway, and hanga enukati obviously, tang de muna buy after them talk hanga for a while just because yangi favor we lo and for now the delo because nit ku tuti la, but yangi anyway, so yangi. Tell me why this man is walking you down the street, but like, maybe boy, I understand, but I feel like it was wrong the way he did it. Boy, where you on for the many? Boy, you ain't go for it. Yo, you don't understand, man. I felt bad for that guy. Like, okay, munu tona react at that point because kuku boy am la tamit. No mer. There's a way and a how. Munu ka hay bul tega sa mataw jimbini. Why you can tell from the person's face na li nehud ko because nehud ko the fact that ne mungi tuti. He has worked so hard for his body. Now that he's obviously skinny again, nehud ko. But baby, and then he kept on going.
That's the thing. They don't know when to stop. They don't know when to stop.
It's high time people start addressing things
Yes.
at the
I
instant.
think it's an emotional intelligence problem.
Yes.
Like,
To be honest,
These
like
people-
look at the person's face. At least, like
At least read the room. People don't know how to do that. They just open their mouth.
read the room.
You see the person, their vibe has changed because you've asked them something that makes them uncomfortable, but you're going. And you're going.
Still
And you
keep pushing. They push, and then that's the time you get a rude reaction, and then I feel like John
pushed him to the limit. Yeah.
That's it. I've given you the table, but you still.
So I can't even imagine being somebody like with breast cancer and like going through like chemotherapy here, and imagine like, let's say everybody is used to seeing your hair like this, and then all of a sudden, maybe, I think for us girls, honestly, if God forbid, I'll just be throwing on wigs every time without fail because
those things do help. The wigs, we advise our patients, go on, get the wig, try to fix the nails. Maybe you can do
so that would be like the follow-up care, essentially.
Even during the treatment, because sometimes people visit you, they don't know, they know you're sick, but they don't know why you're sick.
Why you're,
exactly.
or what exactly
So
is going
even
on,
during
yeah.
the time, you can, if you're like, fix some, eyebrows here, because this goes away as well. And it's obvious when this
The face is bare.
the hair goes away.
Every hair follicle.
So even the lashes,
Yes.
Jeez.
So
No, I don't think I can survive that. To be
Look,
honest, like I feel like
No, like
my
me,
self confidence would just go.
me, I'm imagining even if I have to do like a makeover and they tell me I should remove this, like
I
God,
barely got any,
I'd rather
so
leave my
that's
bare
fine.
face bare like that and not do the makeup again.
Yeah.
Imagine a Rihanna, so they the foundation, the fabulous brass, like you got the foundation and then the brass is not showing you. You look at yourself in the face, in the mirror. Without the eyebrows,
look
you
like
be
a-
like, what's going on? So imagine
like
I
me,
want to
you
go
look like a
through,
butterscotch
like for a
or
whole maybe 3 months
Malteser.
or the duration of months, and you have to look at yourself every day in the mirror.
Every day.
And you yalla bo abina natasa once in a while, hold Natalie, go hold.
So that's a bopper and you start
Right.
hating
Like the
yourself.
throwbacks. Hey, I would be sick.
Bro,
it's difficult.
honest, that's
it's
a lot.
difficult.
Like,
That's why you need a whole village to support you. You need friends to be there.
Support
you
groups.
need a family.
family.
You need people that wouldn't look at you like you're different. Because that's one of the worst you can do. Look at they know they're different, but you should not say it.
Yeah.
But you should pretend it's not there.
yeah.
They're like, oh, my eyebrow. You're like, which eyebrows are you talking about?
Ah.
You have
That is
Just
like
throw
being
something at
emotionally
you, like,
supportive.
what?
But then sometimes I don't really blame the people because maybe they don't know what's going on. You know, obviously I just see Mojan with her brows and I'm like, okay, Mojan, what's going on? So if you have friends, maybe explain to them what
Exactly.
you're going through.
Exactly.
Open up and
Yes,
normalize. We should
something like-
normalize talking
Yeah.
to
Well,
people.
Yeah.
you have a guy meaning sutura at koba koba you apple the koba koba the koduga siron the just because sama sutura. But I feel like
Yeah.
dafa am yenn feebar yoo xamante ne dañ passé nañ fi sutura. Because yow yaa ngi try pour recover and you, like she said, you need the village to help. You need the support. So they need to know what you're going through so that they'll come correct when they're coming to you. So it's not like, oh, you ngeen seti kuy dee or whatever. Like, you know, ñëw ngeen waxtaan du xool sa kanam bi or but yaa ngeen nobu to a point boo xamante ne su ma la laajtee yenn questions, you can't really blame me because I really don't know what's going on.
Yeah, so I think some of the fear in telling people is that they're gonna spread it. And like I said,
I've never heard that one. That's crazy.
It's true though. But you know how Gambia is.
Every sickness, they think it's contagious.
What's horrible about it is that sometimes they don't make it the close friends. They're gonna be like, no, gentlemen. No, they're gonna be like, have you, they can get hell. Like, have you heard? Oh, it's so sad. You're spreading the information while you're acting like...
and the thing is, you don't even know like the full story.
You're
just
acting
going...
like you're being sympathetic. When you're actually spreading the information, you're coming to somebody and saying, this son of a favor, they can cancel. Like... You're spreading the information like right there.
And you're spreading the information like your mom. It's like
you're caring.
Trying to be scandalous and stuff like that.
Already. You don't gotta do it like
Exactly.
But I think the narratives have changed. Considering the fact that I knew nothing about breast cancer when I was in like early 20s. Because in 2019 I've heard less of it, but considering then and now, a lot of people are being aware of the fact that this is happening and everybody needs to take a step towards it. And also going for screenings and all that, because everywhere you see, every October you would see like people placing screening, you need to screen yourself and all that. So this is really like a positive note for the fact that we are being able to normalize things and having these awareness campaigns and all that. So big ups to you guys.
Yeah, you're actually doing a good job. I feel like right now, October, everybody knows.
Yeah,
everybody knows.
Everybody knows. Every company, everything they celebrate, they either do like they do something, you know, in recognition of the breast cancer. So it's actually, you know, I mean, it's slow, but we're going to get there.
It's an important first step. Like at least there is this thing, because I've seen women rush. Okay, breast pain. I heard this, that. I'm like, okay, it's just breast pain.
It's just breast pain.
I mean, you can't blame them.
Yeah, so it's good. I'm happy when I see women rushing and then I'm like, my breast.
If we run.
So there have been a lot of improvements, especially with regards to breast cancer in terms of the knowledge. But you know, there is attitude and there's practice. So it's just not knowledge, the attitude.
It's not just wearing pink.
Yeah. It's actually when somebody tells you, my breast does, because you love, sometimes it's just out of love. You're like, okay, like you don't even want to go that far.
Yeah,
it cannot be my friend.
It cannot be my friend that's going
mother.
through. That's true.
Yes, this cannot be my sister.
True. That's true.
Like you dismiss it. Even how this happens to even healthcare workers. If you have a loved one, you have a bias. You can't just go there and say, maybe it's cancer, let me go. Sometimes we also dismiss things that are relative. So the knowledge is improving, but now we have to translate that to positive attitude and then practical practice.
Practical.
Like, let
I was about to comment.
Man, léegi la suma xel bi dem si Lisa. I used to hear or heard like every time when you're done with your menses, try to massage your breasts, like as a lady growing up.
Okay. Wow.
Because it helps compacted muscles here or homily just to loosen up. I don't know if this is a myth or what, but how true is it?
I've heard a lot of people say it. Even today, somebody told me that, like, is massaging the breast going to help protect against breast cancer?
This that you're talking about cells. Unless you open this thing.
No, I used to hear it a lot.
Yes, even today, somebody has told me about that. Massage does increase blood flow and stimulation. And the good thing about the massage, the reason why I'm not going to dismiss it is because you're massaging and you're also palpating for lumps. Because when you're massaging, you're feeling your breast. So
okay,
we encourage women to massage their breasts. It's very good.
Don't do it in public though. You know how crazy you'll be looking in the middle of...
No. So just once a month. We don't want also to cause paranoia. Right. Like people cannot just be there, my breast. Because I've had a patient that insisted that she had breast cancer, my first breast cancer.
But it's
Yeah,
not
because
there.
usually they say like when you're done with your menses, like because most people like when they're on their menstrual cycle, usually the breast is heavy.
Yes.
Yeah, and it's tender and all that.
So 2 to 3 days after your menses, you can start massaging and checking. Let it just be regular. Understand how your breast feels. So when there are changes, you'll be able to spot it.
Man, like, go on now, 'cause I used to do it.
Man, kaya xam naa ko, ba nga expliqué affaire yi nga xam nga su ma nit ki daf daan def.
Okay, but it's good that you brought up even
So for women that have stopped seeing their menses, we just advise that they pick one day in the month and then they just check.
So once a month.
Like menopause, basically.
Yes.
The menopause. Okay. So once a month. But you bringing up about the myths and stuff like that, is it another perfect segue? So even with all the information and stuff like that, there's obviously this, I feel like even though we have the internet and there's a lot of information, there's even more misinformation.
Yeah.
So I wanted to know like what are some of the biggest myths you still hear from the patients or like the public?
Yeah. So I think the ones that I'm going to go after, there are a lot of myths. The ones I'm going to go after is breastfeeding women. Like you're breastfeeding and you feel a lump and they're telling you it's the baby that burped on the breast also. So you can be pregnant and have a baby and be breastfeeding and still get breast cancer. So when you have a lump, every lump should be checked. This is it. Whether it's an abscess, like I said, but you cannot just sit down and say that's an abscess. You need to still go to the hospital. So every breast lump should be checked by a healthcare worker.
Every breast lump.
Every lump. Every
Emphasis on every breast lump. Being it man,
A woman.
exactly.
breast
If something is off with your body, just go to
As far as it's a breast, it's a breast.
That's it.
the breast is the breast.
That's
Thank you.
it. As far as it's breast, it's breast. It's chest, oh, it's breast, oh. As far as
Exactly.
it's breast. When you see lump, go and check. Baile nobo.
Exactly. I also wanted to know, like, I'm sorry to cut you off. I wanted to know, like, how, if you've ever had like any case that had to do with like maybe like misinformation, for example, because I know misinformation can delay like the diagnosis. I don't know if you've ever had that where somebody came to you with something wild that they read online or whatever, like regarding
So
like,
the
it'd be like
lady that insisted that she had breast cancer, she was actually reading stuff online and they told her stuff and she's like, it's
and I'm sure what she was reading
she was
was
insisting.
probably
The lady
just
did
Some small.
some small something. And you know what's up?
so online basically they just put everything out there. This is it. They put the good, the bad, the ugly, everything. So you won't be able to understand which ones are. Because for instance, if you Google abdominal pain, they can tell you cancers. They can tell you a lot of
Google.
They're gonna tell you
You
everything.
say
so you would be
my
able
ear
to
is aching. Google's like, you have 5 days to live. You're
Hang on,
going to
one more thing,
die.
amazing.
What?
You will just miss your period for some days. And it's like signs of pregnancy.
Yeah, yo.
So buku tee sa heart bi mu rot dugal fofu nonu rek ngay commencer di ut like nga just get I don't even
And it's like, oh, I feel pain in my breast. You
Signs
go
of
to
pregnancy.
Google, and then Google is gonna be the AI is gonna be like signs of breast cancer. Dead.
all
I'm
the
dead.
sickness that all the words that I've never hey, please just stay
So
away from
let's see. Okay. Coming back to the topic, breast cancer, right? How has it been your job when it comes to because I know
You're specifically family medicine. Yeah.
yes, come like usually most doctors like when you go for a result and it's positive, you can see that nervousness in them to breaking the news to the patient. How do you maneuver around those type of situations? Because I know it can be really hard.
It can be. So most of the cases you're relatively okay because it's routine for you. You're seeing it, you okay, there's that. But there are patients that come to you that you definitely have, some sort of more emotional connection with. So it's difficult. Like I had a 28-year-old recently that was diagnosed with breast cancer. It was sad. I had to sit down and take extra time to really, put her through because she was in denial. She has not accepted that she has, and she's heard about breast cancer. Like she's been
but you
around.
think it will never happen to
It
you.
cannot be me.
Yeah.
Yeah.
Oh,
So it's difficult. Like you hear it, it happens to others, but
you cannot believe it. Like it's happening to you.
It's not you.
Chai.
So it's difficult.
so
So those
sad.
patients, you basically, as medical professionals, by the way, we are expected to have empathy without getting all the emotions involved. Because imagine you're supposed to see maybe 30 patients in that day. And then you spend that one time, the patient cries, you cry, the others are
Emotionally exhausted.
You're emotionally exhausted by the time you're done talking to them.
So we are supposed to have empathy. In fact, sometimes we train to have the empathy.
The way they train you out, because some of these nurses.
I know.
I'm saying.
know. There's room for improvement.
What do you
definitely.
say about that though,
Yeah.
in terms of like, we've heard so many stories, like not just, having to do with cancer, but just in general, like these people, like even when we talked about the healthcare stuff, like the first few episodes, a lot of people I saw in the comments were talking about their experiences with these healthcare. So what would you say to those people?
For which ones? The group of people complaining or the ones that are the accused? Is
Both.
it the accused?
Yeah, both of them.
Yeah,
What would you say to the
for
patients?
The accused.
Yeah, the accused.
The accused.
Help them with their case.
Allegedly.
Accused. These are all alleged.
So I know that the healthcare profession can be very stressful. And sometimes, like any other place, like it can get, you can feel like complacent basically. You know that these people are coming to you and you're overwhelmed. So instead of just trying to know that the job is difficult, you're just losing it. Yes, and there are some patients that don't make it easy at all.
I'm not going to lie.
Sometimes it's not the patients, it's the escorts. I mean, especially
Oh.
RTA, like you have a small laceration and we have maybe, like you meet a doctor or a nurse that has 6 patients and maybe 3 of them are emergencies and somebody comes with a laceration here, and then they check. They know that we move to Reiki, we know which ones the emergencies are because we're going to run to the emergencies first before we lose those patients. And then you have 6, 7 escorts in the room
Just for that.
and then they're all stressed. Obviously, they feel like, this is the most important patient in the room right now. But to us, yes, there's an important patient, but there's a priority list here. We call it triage. You have the emergency, urgent, and can wait. So imagine you look, and you're like, can wait. For you, it's can wait. For them, it's like,
it's
Do or die, like to do it right
do
now.
something.
So it's very common with those with accidents, by the way. They want you to leave everything you're doing and then come and check that. And sometimes, especially when you're on call, you're checking, you're not only, you checked, but you're also communicating with the other doctors for the management, for the plan. Are you admitting? Are we not admitting? Because you're not the boss of the team. The consultant is usually the boss of the team. You need to communicate with them. So sometimes what looks like neglect is just maybe poor communication. Like I didn't tell you that, wait, this is the plan we have right now because sometimes there's a lot of communication issues.
It makes sense.
So the first one is that sometimes they are shouting at the patients or they're shouting back. That makes it difficult. So healthcare workers are expected to be angels. Right. So it's difficult. I have seen some, and I know that the way some healthcare workers talk to the patients is outright wrong.
Especially some that this person is sick. Like she's going through it.
She's going through it.
Sometimes they not had it, but they have a fever. Fever definitely you before having you think you're about to go.
And you're panicked constantly.
No, honestly, I would really give a shout out to the Gambian healthcare professionals because back in 2022, when my younger sister was involved in a very fatal accident, we were at Namban for 3 months.
For 3 months.
For 3 months.
Later.
Yeah, she had multiple fractures. So she had to undergo IM nail and she had a fracture here, and a skull fracture as well. So the duration we spent in the hospital really changed my narratives of Gambian healthcare professionals. Because, I know that they are jambars, like they've been really doing amazing work, provided that the equipments they need and everything is
the infrastructure, Mom, that's another topic.
They would always improvise and do like the amazing work. So there was a day, because my sister had like glasses in her hair. Yeah, so then corona gene. So sister be fanyo mo gene. My younger sister just looked at her and be like, sister, the nurse no ko sanangam tande. So if it was someone else, the person would react. But the nurse just laughed and said, Danga fever. So tani. So that made her laugh because it was really like a traumatic experience and I've learned a lot from that. Also, I've seen a lot too.
But I've seen that firsthand with my sister's first pregnancy. Yo,
God.
I was like, hey, are you sure you're supposed to be here? Because maybe I think you're supposed to be a carpenter, because I'm not sure that hat of yours. You see, you want to
We need to review your license.
No, to be honest.
Yeah. Some of these healthcare providers.
That clinic or that table or that whatever that thing was going on, I was literally crying because my sister was inside and she was shouting to a point they had to take me outside. So I would tell Essie, you see, if you yap me, I was doing this labor thing with your mom. So you cannot tell me otherwise. You know what I'm saying? But I just feel like they really need to, especially Jigen Bubi. But I can tell the mate it from you. So
It's difficult.
it's just the way they be. How sa comme ñu la laajte question soo gisee kooku mu la laajte dafa bëgg a métti bi mu so mu ngi seet comme lan moo ko dimbale yaa ngi ko altoo comme doo toog doo xaar xanaa gisuloo lii doo comme doo ko I feel like the way you communicate to people moom mooy tax understand I feel like soo ñëwoon si moom baalal ma de mais ma tuuti rek maa ngi xam naa ni métti na
It will make a lot of difference.
It will make a big
like kooku si dina xam ne ok kii mu ngi si suma case waaye naa ko may tuuti you can tell why is the way you just be saying things and I'm like are you not human because hana you do the favor.
Yeah, so in every system there are good and bad stories.
Yeah, for sure.
Unfortunately,
For
though,
sure.
the bad stories go
Correct.
faster than the good ones.
Oh, for sure.
For someone that's not happy, it's likely they will go online. Just imagine, when last did you hear a positive story about a positive experience?
Yeah.
It's difficult because they don't come out. They don't come.
That's true.
They spend
That's
the
true.
time talking
That's
to
true.
you there. Yalla,
Yeah.
mala, yalla, definitely.
Yeah,
So
yeah,
you do
yeah,
hear it, but nobody else hears it.
Yeah,
So,
that's
but
true.
let somebody have an
tiny
issue at
thing.
the hospital, and then there's a
Over.
whole book on.
There's
on-
a whole
on-
live
on-
session for
That's
you.
true. That's true.
So I do agree that there are more negative stories out there than positives, but there are positive stories.
They're actually very
There are survivors
nice
of
nurses.
breast cancer in this country because somebody held their hand and took them through.
Oh,
So
a quick break. Come.
You somebody
Welcome,
of a
Hannah.
somebody. You somebody of a
She be
somebody.
busy, you know what I'm saying?
The
Working
working
gal.
class lady.
Working class lady, period.
Working
Period. Hey, girl.
Hello.
Hannah, guys.
Working class lady.
Thank you for
What's
coming
up?
late.
Thank you for coming.
Thank you for gracing us with your presence.
Must you tell them?
Thank you for coming late.
Thank you for coming. But I wanted to also say, like, I guess the fear and with us talking about the healthcare system and how, like, you know, they don't really have good things that we're saying. So do you think that also affects, like, people coming in to get, like, checked and things like that?
I think, like, if for instance, the healthcare worker that first sees you is like, this might be, can make you run away. The way they can approach you can make that person just run off from the hospital.
Exaggerating that
No,
thing.
you ask a question and they're taking 30 extra seconds. You're like, I'm dead.
I'm
I'm dead. They don't know how to tell me I'm gonna die. So,
Yeah, so that can
crazy.
limit the number of patients that follow up. Yeah, and then they would come back. But usually you spend 4 months out there already and you have not been diagnosed, you have not started treatment. That makes a big difference. So I do agree that the communication is part of. And then during our training, we had a whole module on communication in breast cancer care, particularly so that they know how to approach the patients when they come.
As the saying goes, early detection saves lives.
So you sorry, so you stated like obviously from stage 1 to stage 4, like, and you also stated like maybe the smoking part that would lead to that, smoking and drinking, obviously, then being active. So do you think, like, for example, if a person has like stage 1 cancer, do you think it slows down the stage 1 from going to stage 2
still
if you are
smoking?
yeah. If you're
Because
still
the body is is supposed to regulate the growth of the cells. So your immune system is what does that. If you have, like, you're smoking, you're weakening that system. If you're drinking, you're just basically weakening. And then those things are also carcinogens, meaning they help cells convert to cancer. Normal cells, it's not like something comes into your breast. No. It's the normal cells that just go mad. Like, and refuse to follow instructions. That's it. It's not
so
like
my thing
something
is-
comes in.
So the cells can just decide, they can just wake up tomorrow and start spreading. No, I'm just saying, because I'm like, the way I'm visualizing it, it's
So
like,
it's
they're
like okay, let's take a proper example. Come nit mu just show up at your house without notification or unannounced.
Example.
That's a
Not
perfect
telling you
example.
I'm coming, and then you
So
expect
it's not one
food.
person.
So-
Then
Yeah,
the
group
others
of
start
people.
coming. They start coming bit by
Gani
bit.
yung bolo.
So this is not neat. This is your family member just waking up one day and just going crazy on you.
Yeah. Like you're chilling, it's a regular day.
Right?
They just come and start.
They change on you, and they start maybe insulting you and not filing and all that.
So okay, now I'm stage 1 cancer be. Maybe mungi def like things right. Maybe the person is not smoking, is not drinking, mungi exercise, mungi leka you bar and everything. It slows down, right? Mungi skip.
Compared to ko xam ne mi ngi am weak immune system, di ngeen yan ñaar. Di ngeen di wax ne kale mooy gana tane because mi ngi am a healthier body than keneen ki.
Takes time, basically.
Because like any other disease, so I may other risk factors, other diseases, for instance, so I may other chronic diseases. Don't time the fly now because you're already dealing with that.
Yeah, your body is already
You're already
going
going through a lot.
That
Yeah.
also makes sense.
So with the immune system, how can people, what are little tips that you can tell us, like how people can improve their
Decrease the risk of breast cancer.
Yeah.
Exercise.
Exercise is
like
one.
that exercise.
Good diet. Good diet.
Okay.
Yes.
Okay.
And then our diet has changed a lot. Now, if it's not pizza and burger, we don't want it. We don't.
You want to do American lifestyle. You don't know these things, they are ruining their bodies. But it's okay. I mean, if you choose to go that route, it's up to you. But as she said, exercise and eating healthy. You just be drinking all the dealings in your house.
Yeah.
That's up to
Especially this palm oil and all of that stuff.
Yeah. So the plant-based foods are better.
Plant-based. Do we even have that option? Like those options that readily? Yeah.
Like there is a restaurant, Boneka Senegambia. I have not seen anybody enter that restaurant. It's a vegan.
I mean, you bring a vegan restaurant in Gambia. And you expect
No,
people
they're
to
gonna
be
be like, girl, our diet is rice and meat.
That's the thing. So it's difficult. I'm sure they're still operating. People do go there, but I have not seen a line there. But the Afro place next to it
It's doing a
is
great job.
doing good.
See our priorities, so I get it. But see our priorities.
Even the ones that are from exercise, they will still branch
No,
off
but low
and buy
key
some 1
though.
kilo.
No, if you like that. But low key though, after you work out, you tryna, people like me, we
You're
try to
trying
get
to do
small
what with the meat,
wins.
Mojan? What are you trying to do with the meat? At that time of the night, 8 o'clock.
Okay, I don't go that far. I won't say 8. Maybe 9. I'm playing.
Yeah,
I'm playing. But I wanted to also know, like, as we're talking about like awareness and things like that, I guess with the media landscape, like us growing up here, because we did talk about like throwbacks with the GRTS and all of that stuff. Would you say there has been a shift in the media, like not necessarily social media, but specifically like television and radio? Have you seen like a shift from like, well, how long have you been a doctor for? Have you been practicing?
2.5, yeah.
Okay, 2.5 years. So, in fact, so growing up here, like, what have you seen? Like, how do you think things have shifted from like early, like let's say early 2000s, I would say, till like now?
So I think the media has jumped on the wagon. They're going with the way. As long as news so anybody doing a screening, like media come.
Yeah.
So they are waking up. Everybody's waking up at the same time, luckily. They're part of it. They're big advocates of it. Because in a hospital, me and Dr. Jitteh can see and talk to patients one at a time, one time. Maybe at the day you see 30, next day you see 20, 30. But you guys in this platform, you're able to reach more people. So media is very important.
Yep.
You're able to reach the masses at the same time with one episode.
Yeah,
so they have a big role to play in the advocacy.
Even with the
Individuals. The individuals, spreading, like posting stuff on the Insta stories,
if you
they
have the
snap
following and if you have the crowd, like I feel like you should actually take part in these things.
Would you agree, Miss Social Media?
Leave her.
This one.
Leave her.
This one.
Yes,
Raising
I'm
awareness.
late. You want to make it
so?
obvious that I'm late.
No, we want this. No, but the thing is,
Can
because I know
not
they're going
just
to
shut up
no,
and behave?
because they're going to tell us, oh, why isn't Hannah saying anything?
no,
Because they
no.
came for us about Chaser when he was not saying anything.
How we are bullying Chaser on the
No.
Chaser was just having Chaser was just there to feel
Today we are talking sense. I'm coming down. We are learning. You understand? I'm taking my
So at
time.
give
least-
our
at
madam
least-
heads up that we are loud. So she was prepared for that.
So she was prepared.
She's even joining the crew now.
We
You
are
know?
loud. We are loud.
No, but because we're talking about something serious, I know everyone's going to be like, you guys should not be laughing. Anyways.
No.
Humor,
You cannot make
you
it
know.
depressing. It's
Right.
already depressing.
It's already
You cannot do that to our
The
people. Come on
topic
now.
is depressing.
You know, so
because
you
it's like,
can't be-
because I don't know me personally, I don't know if y'all know anyone personally that has, you know,
actually two people.
Two people?
Yeah.
Is it in the family?
No.
Okay.
Far off, but
Far
one
off,
was one of my schoolmates. She went to America, went through it, and then came back again.
She's better now.
She's way better now. I think.
That's nice.
Would I say environment sometimes just plays a part in
I
making
think
it
if
more
you
depressing?
can
That's a
afford
good
it,
point.
move a little bit away from if that's just my advice.
Yeah.
If you can afford
She
it,
did that.
move a little bit away from your normal environment. Because there's a tendency that they will always remind you. Sometimes you forget because now you're in your body. You just
You know, you
moving
just
and
want to
somebody's just
enjoy.
gonna poke you.
like,
yeah.
Oh, what about this? You're legit Sally and
will
all that.
just-
It's just
Well,
He might have just
some
back-
child like me that cannot manage business.
No, the children.
These were the ones that we are talking about.
Auntie Lutanga Ambena.
This is what I'm saying. This is exactly what I'm saying.
No, that's true. But then I
But
feel
that's
like
how they
also
do, because-
no, but I feel like with kids, like speaking about that,
Yeah,
I think that we can
blame these
normalize. No, not kids. But like, I'm not saying you gotta say like, oh,
Kids
they may
like big
ask
kids,
me,
Moja.
you know.
Because kids are gonna be kids, and then
No, I'm saying in
you know,
terms of like educating them.
you're used to.
I'm not saying that
drawing-
give them the full graphic.
You can't really
listing.
teach them how to ask you the question.
Come on,
No,
no. I mean, I'm
Then
saying
you
with
have
how
to
we
draw them.
respond. Not
Yes.
saying how we
Then
respond
now
to
the
them.
response
Yeah.
makes-
Kids will be kids. They will be like,
No, they will
you're
ask you, why is
what's-
it one? I mean, even then I'm two. Everybody two. Why you one? Then that's the time now you come forward and explain to me in I don't know, in layman
How
terms or
layman's
something
term for the kids
then
and
maybe
stuff
say,
like
oh,
that.
Okay.
Yeah.
But then they will still
And the thing is,
respond.
kids, they're
Ooh,
sponges.
Speaking,
You know?
how can I ask a question?
Yeah.
What's the earliest stage breast cancer has been detected in a person?
the age.
Yeah,
I think it's 14. Was it?
14.
Yeah. but those are-
Pregnant. Stuff like, I'm sorry. It just
Yeah,
reminded me
that's
of
like that's crazy. That's why we are
That's
not able to say
crazy.
like go and
14?
study. 40.
Oh, did it happen here or just some? Was it here or?
Majan,
In Gambia, for
she ain't even got tits yet.
Bro, you just started puberty. Just barely.
So that goes out. This is an opportunity to tell mothers if your child has anything on the breast, it's good to get it checked out. Not only breast, there are other cancers all around. Yeah, anyway.
I think we
It's
definitely need to
important
encourage more of like just doing physicals, no matter the age, just to go.
age, yep.
And that's 14.
Yeah, so it's
Your life has not even started yet. Barely.
which one is life? Do you have life certificate?
Barely. You're still. You're still.
Wow.
What?
yeah.
And do they have to go through the whole like the whole treatment? Adults go through the whole therapy.
So
and
the chemo would be measured based on the weight of the patient. So this body surface area we measure. So we'll give you an appropriate dose for that.
wow.
But cancer is cancer, irrespective of what
serious.
your
It's
age
serious.
is.
And the thing
Because
is,
it's not just breast
crazy.
cancer. Kids actually have their own cancers.
Yeah. No, I've
Kids?
seen the what's the hospital? St. Jude's Hospital.
Yeah.
Somewhere in
They have their
the
own
videos is so depressing. All these little kids, all kinds of leukemia,
Yeah,
everything.
right.
You
So
can
they
think
have their
that's-
own
it's
group
crazy.
of cancers.
Oh my
Pediatric
goodness.
oncology is a whole specialty all by itself,
Okay.
meaning pediatric cancers.
That's depressing.
So breast is just maybe this
Just
is
yeah.
yeah. Initially it used to be 19. We had a 19-year-old, and then this one just stopped the
14.
shots for now. Yeah.
And like, are there ways of like trying to help your body to prevent them?
Yeah. So there's no definitive prevention for breast cancer, unless maybe you want to remove the breast, but that's crazy. That's not prevention.
There's
We
no,
won't count that as prevention
There's no
anyway.
one. There's no cause.
Yeah.
It
No,
just
A healthy lifestyle.
Yeah, a healthy
because-
lifestyle, exercise, diet, avoiding the smoking and the drinking of alcohol. Yeah.
Okay.
Because those don't only just prevent you from breast cancer, other cancers as well. You have the lung cancer, which is all
Yeah, that's why we stuck to
lung,
specifically
and then you have the
breast
cervical
cancer.
cancer.
Yeah.
Yes.
Yeah.
Yes,
Which is
Yeah.
something
that
that
one
is
is
not
more
talked
common than
about.
Yeah,
breast
we
cancer.
definitely need to talk
here.
about that for sure. That's
Yeah.
crazy.
It's
because,
more common
yeah.
than breast cancer in this country. In other countries, breast cancer is more common, but here, cervical cancer.
We're gonna talk about that. We only touched on a little bit because we're telling people to stop buying stuff from the Snapchat and Instagram people. Just shove it. He's okay. He's all right. He's okay. We're not even gonna get into that. But what was I gonna ask? I wanted to ask how. I think we kind of touched on it a little bit, like how families and communities can better support patients emotionally and practically. The practical part, I know emotionally, of course, like I guess being there for them and not. No judgment and stuff like that. But what are like some practical tips you can say for the communities to better support them?
Okay, so for immediate family members, I think the first role is to not make it worse. pretend that you're not seeing some of the things. They're like, oh, can you check? I'm like, oh, what are you talking about? What? Like, I would do. Like, those things can just not make it worse, but you're like, that's a whole different situation. And what are you talking about? It makes they know, like they're mirrors, they know. So the surrounding is important, making sure that you have people that you trust. And then because when you don't want to come out, it's not during the treatment that you want to come out and say that you have cancer or so that stage, keeping it close by and making sure that family members are helping with the food. Because you not want to eat sometimes. So you need someone to be there to say, hey, have you eaten? Have you had this? Have you, when you don't really want to take it, but you know that there's someone there helping with the food. What I've also heard patients say is that the cleaning of the house, their friends used to come bring groceries and clean and help. That really helped them out during the process. And also if you have a friend that can help you walk around a bit because some patients don't want to do anything at all. They don't feel like it. It's so difficult to get up from the bed. You can have someone to hold your hand and say, let's walk around this block.
At least fresh air and things like that. Just leave the house.
Yeah. So the support is non-replaceable. And we started touching a bit on survivorship. That's a whole different problem all by itself because now you're not in the treatment phase anymore. In the treatment phase, you're like, oh, when is my next cycle? I feel this terrible. In the survivorship phase is trying to now, they're like, you're done, now you're back into society, you're trying to reintegrate because you're done with the treatment, there's nothing else to do at home. Then it used to be go to do treatment and then come back, see the doctor, that used to be your life. Now doctor is saying, okay, see you in 3 months, see you in 6 months. What do you do during that time? That's difficult. You go back to your work. Everybody knows you used to have, all this glowing skin, and now you're trying to get it back. It's not there yet, but and people do recover well. People end up getting really curly hair after the chemotherapy, like black hair that they've never had before. So some do recover very well. The eyebrows, they come back. They recover. The nails they also recover.
But do you advise them to take like supplements or stuff like that to just help them boost that?
The supplements, it depends on which type because, you're recovering from cancer. You don't also want to give something that would make that thing come. Because some of the, if you did chemotherapy and maybe they blasted most of the cells out and then that's good, but you still have some remnants and then you're taking supplements or growth hormones or whatever to bring that too would grow because it's still a part of your body.
So you would just advise to
there's some that you can take, there's some that you have to ask a healthcare worker whether you can. So some are immune support just to make sure that you come back.
Maybe like multivitamins and stuff, maybe? Okay, what would you suggest? What are the few that they can take without
for instance, for bone health, you can go after supplements to help. So some people have issues with the bones because the treatment, like I said,
the treatment looks very intense. It looks very intense.
We go after the symptomatic treatment, like the nausea will give you something for that. The bone health will try to give you something for that. And anemia is another problem. So those supplements will try to give. But usually it's folic acid.
Folic acid. Okay, I've heard of that one. Yeah.
You should not be on that one.
You should not be on folic acid. Okay. What are the ones that you would say is like a no-go? Folic acid.
Not necessarily.
There's a whole list, but folic acid is
But it depends also on the agents you're taking, what type of cancer you have.
Okay. Interesting.
I feel like this cancer is a whole...
That's why we specifically touched breast cancer, because now we have to go to the other. We're gonna be here for 5 hours.
Imagine if you have the cancer alone. That aside, the chemotherapy alone. That aside. Now she's saying you have to come back now to society because obviously you've been gone for.
You're starting from ground
now
zero.
It's like you're really trying to walk and do everything.
And you came back with all sorts of sensitivities. Because it goes after your confidence. It goes after your confidence as everything that makes us girly. It goes after it goes after your breasts, it goes after your hair, your skin, your nails,
everything.
Everything that makes you feel confident. That's how you come out as a warrior.
You're working to come back
to
the
body that you wear.
Yeah.
Wow.
That's
you're
like
already walking like this. We are walking.
Yeah.
Imagine if you have to go through all these things
again.
Wow.
So I wanted to ask, speaking of like community and things like that, how can men be part of the awareness efforts?
Yes, men.
men.
No, I'm just asking because we
They're
need
biggest
community
partners in this.
Thank you, especially
because-
the husbands and things like that. Yeah.
Yes, and the breadwinners. Sometimes women don't have the money to be, and they have priorities. They're
Yeah.
thinking you have $1,000. You're thinking of the kids
The
and
kids.
their school fees, and that's lump that is not even disturbing you. You have other issues. So they can be. I could say they're biggest implementation partners. If you're going to do anything, just like gender-based violence and the FGMs and all the other things that we mentioned, men are our biggest implementation partners. If a man supports his wife, irrespective of what cancer it is, he'll go through it, and then she would likely survive it a lot of fat because she has that support, intimate support, that someone is there. But if the man avoids her, goes to the next room, or starts to say things that are not very pleasing, she's already dealing with self-confidence, self-esteem issues, and this is a tough diagnosis. That's just the truth of the matter. It's a tough diagnosis.
It is.
So if they're there to support, they give finances, they give moral support, they bring her to the hospital, they force her to come and they encourage her to eat.
Yeah.
Those things.
Sometimes dinner a week, sir.
Right.
Yeah.
So those are things that are really helping.
You know, take you out.
Yeah, so
stuff like
lip
that.
gloss, lips,
All of
you
the
see,
makeup,
spas as
everything.
the way of supporting.
Supporting, yeah.
The wigs are away, the spas are okay. And then sometimes we have those sponges we put for the other breast, for instance, if one breast is
They
taken
did
out.
a mastectomy.
So that
yeah.
it wouldn't look like knock away. Look at your
Yeah.
So you try to put some pads in. Even for those that have a double mastectomy, you can still have people are
bras
designing
that are-
beautiful
yeah,
bras
yeah,
now.
yeah.
People are designing different things for amputees and
Yeah.
so they're actually considering them. So
Okay.
with the way life is modernizing,
There are a
it
lot
wouldn't
of
have. It would.
improvements.
I don't feel like it's going to be obvious in a couple of next years.
Oh, for sure.
With the
sure.
with the way technology
Is
going.
advancing.
A lot
Hi.
more survivors. Yeah. I too, me too, me too, me
Yeah,
too.
No, I mean like it wouldn't be obvious like before.
Yeah.
Like when there were no silicone padding.
Right.
Nothing of that. It was obvious. Yeah.
But with the way technology is moving, even like if you go through it and overcome, like if you can afford it, and I hope it, and I pray it's actually cheap.
That's the thing. The accessibility.
It's not
Yeah.
very cheap, but
it's
those
not
that
very cheap,
can
yeah.
afford it
afford
can
it.
actually get implants.
Yes.
other
So
countries.
Yeah.
it wouldn't have to be that obvious because life can be crazy, huh?
It's tough.
Life can be crazy, but we live for better days.
Yes.
Oh, please, can you explain to my sister here? We need to be doing these checks. You
You
know?
have to be
Yeah,
doing the
I've-
self checks. She said to
Because I'm
raise
sure
your
you cannot
arms
be
and
you
things
don't-
like.
you're a body. You cannot be going to the hospital every day. So let
Auntie
our
comes out, I do be checking. I'll be putting my hand up.
Period.
I'll be doing
Period.
she's already game. She's on top of her game.
I'll be doing this. I'll be doing
She's a
that.
body.
that.
And you know, buddy,
all
buddy
of that,
can't be going
all
to
of
the
that.
hospital all the time. She don't have the time.
I've touched all the cities. I've touched everywhere.
So
I
I
am
want.
very considerate of my body parts.
No, you have to be.
Yes.
So that you can detect it early.
Me that is on TikTok doctor like this. Everything I did.
Doctor
This-
said, now
this
that's
there?
it. If you
Adelano.
But I wanted to know,
Adelante.
like, what role, like, NGOs, clinics, and public campaigns play in, like, the community efforts, essentially.
Yeah. So, for instance, at the hospital, we see patients, but the hospital cannot necessarily be able to go out and say we're reaching out to other. They're not as light because they have the whole burden. So NGOs can actually reach out to communities. You can go because you're more mobile. You can go do screenings in regions. You can go reach out to the alcalos, the village leaders. You can engage them. Yeah, because engagement is the new word in town.
Yeah, it's a new currency as well.
Making connections.
They're able to reach out in ways that maybe government can, and especially public-private partnerships. Partnerships work. We can do it alone. This is not a one-person job.
Nah, that's true.
It's everybody. And the good thing about breast cancer is that in the month we see that people come for other checks more. Because now we're checking, healthy. And then others remember, wait,
Actually, my leg
actually
was
have
doing
another
somehow.
problem. That is not this, but I will still go to the
That's
hospital.
good. That's good.
So it does help. So it's a way of also increasing the engagement with people that have other conditions that are even related
That's true. That's
to this, but they still show up. And those conditions are not less important. They are important. Yes. So it helps. And clinics now, they're doing screenings. And
They're doing free screenings, obviously. And I think that's very important, especially in the country that we're living in now. I think we have to be, especially with the NGOs, the clinics and stuff, I think we need to also make efforts to make sure everybody is able to just access healthcare. Because I think that it's a right, not even, it's not supposed to be a privilege, you know. That's
so
how I feel.
there are a lot of screening going on. In Banjul, for instance, we have a screening coming up on the 25th and the 26th of this month, October, the last Saturday and Sunday. Basically, there are a lot of funds that we are trying to gather so that women can do it for free, because healthcare is not free.
Yes.
Somebody's paying for it.
Everyone's
You will
paying
say,
for it,
I'm not paying for it, but somebody is paying for it. Yeah. Yeah. The funds has to come from somewhere. Those
that's
drugs
true.
don't just, you say, I'm choosing Gambia.
Right.
Yeah,
Okay. They're not cheap. Okay. And for those listening, I wanted to know, like, what can each of us do in our own circles to raise awareness or help somebody in need?
I think this is a big start. Yes, this is a great start. And the
city.
ladies are in pink already.
In the city. Okay, yeah. I think we're trying to do our part with raising awareness and stuff. So I wanted to know what is your final expert advice when it comes to breast cancer?
Yes, so I know that it's a tough diagnosis, but people have survived it. Yeah, not everybody is coming out again because of there's some stigma still attached to it. But there was a time we used to be crazy about HIV, but now
And now
we are calm because there are some
medicine,
medications.
all of that. Exactly.
There was a time that used to be the worst word.
You don't want to hear it.
You don't want to hear it. HIV,
Right. HIV is the stigma, but it was fought. People came out, drugs were built. It's the same thing. Breast cancer, like I said, in 5 years, you'll be like, oh, I'm a survivor, me too. I'm a survivor, me too. That would be the trend.
It's getting there. Especially the
Right.
support groups and things like that.
So definitely, everybody can play a little part. If a family member is complaining about something, take it upon yourself to encourage them to go. If you can help, pull their head, and because if somebody has something, like there's a lot of bias, you don't want it to be you.
Yeah.
And it's 1 in 8 women. It has to be. Who is the 8th woman?
Who's that one in the 8? Who's that one in the 8?
Gotta be somebody.
Exactly.
So that's it. So when you have somebody complaining of a symptom, don't dismiss it. And then again, traditional medications don't cure cancer. They do not cure cancer. I don't know what they cure, but it is not cancer.
Do they actually believe that traditional medicine has anything to do with cancer?
Yes, we have people that come, we're sorry, but this is a cancer or it's a malignancy.
Yeah.
And then they run off. The denial is just, you know what? Yan harli.
I got something.
This is an evil spirit. You're telling me what?
You think it's juju?
So
Somebody
they just run
this,
off
do that,
and go. And then they come back maybe in 6-7 months. And then
Worse.
And then they, sometimes they apply these herbs on it. That makes it worse, by the way. Oh, no. Because you can get infections from that. And now you don't only have cancer.
Double homicide.
You have breast cancer plus breast cancer.
And the breast cancer, when you could have just fixed one.
Right. Wow. So it's difficult.
Crazy.
So a woman, especially breastfeeding women, lump, check it out. You're on a breastfeeding lump, check it out.
Yeah.
And obviously, if people can get married earlier, you have an option, get married and have your kids. This cancer is not joking with us.
Sorry to know, I'm looking at myself.
It's not joking with us. If you have the opportunity, 22, 23, get married. Have your kids. By the time you're getting
and that is if y'all want to have kids, I beg.
I don't understand why that one is laughing over there.
That one, leave him. Then if you guys want to have kids, please, disclaimer.
You think they're talking to you? We don't pass. They don't leave us. They don't leave us.
We're out of it too. It's not us they're talking to. The youngest.
They're talking to y'all.
But
we're living healthy, so
with the support, that just reminded me of this statistics I saw like a while back. It had to do with like the women who had like these terminal illnesses and the percentage of the men that just left them like this.
Yes.
I think it's crazy because when it's flipped, That's not
That's
usually
not
the
usually
case.
yeah. Because society tells the woman this is the way you're supposed to be, but society forgets to tell the man anything.
Like this is a partnership.
Yeah.
You
So
know?
they tell the
It's
women,
crazy.
women know exactly
Yeah.
this,
Yeah.
this. But
Yeah.
men, we forgive
Yeah.
them for a lot of things. And then I don't blame anyone. Even if now society says women, you're okay. And then some part of society say we can be who we are.
Gender equality.
And then things are changing a bit
Yeah.
on both
True,
sides.
true.
Yeah. So, but
So I beg husbands, support your wife.
I mean, sometimes too, they just need to be told.
yeah,
told,
sometimes
yeah.
awareness
Honest
creation. I
awareness,
don't
yeah.
think that
For
they're
sure.
bad.
For sure.
It's not that. It's sometimes it's the way we were raised in the home.
Yes.
Like I said, we tell the girl all the time from
do this, do that, but then you don't tell the boy child.
too.
Yeah.
Yes. So I think the upbringing should be on both
Both
sides.
sides.
Yes, for
Everybody.
sure. For sure.
And then we need to do better with the upbringing for on both sides. On both sides.
So that both can grow up to be emotionally intelligent adults. Before now you take them into the world, now you are causing people to be traumatized here.
Exactly. So they can all grow to be matured adults.
Yeah, exactly.
So in that partnership is everybody can contribute. And this month we're going to have a fundraising event for breast cancer patients. We want to do a surgical camp because we know that we're screening lump. Who is going to do all those surgeries? So it's difficult and the backlog can affect
The backlog,
them. So we want to do a camp a few days and then so that we can do a lot of them and then clear the backlog. And that's why we are doing this fundraising at the Circular East Mini Stadium. Tickets are just $30. It's normal football tickets.
You know,
Yes.
I'm not sure
On
when
the
this
18th
episode
of
will air,
October.
but we'll definitely post it on online and
That
stuff
would be
to just
nice,
raise
yeah.
awareness and things. So I'll definitely send y'all.
Yeah.
So all of you, I'm talking to you people behind the scenes who,
Including yourself
I'm sending you
over there that
people.
you are
I'm sending
laughing,
people
telling us.
the flyer. This is very important. I beg. So we have learned that early detection, proper treatment, and strong community support makes all the difference. So I want to ask, what's one message you'd like every listener to remember from this episode?
So we fight together and then we can survive breast cancer.
Bagam.
And on that note, my hot boys and girls.
Boys and girls.
She has her headphones in. If I do pew, please.
She's not used to
I
people.
don't. I don't want
Hot
so.
boys.
Hot boys and hot girls.
Boys and girls.
Before you
I just
understand,
want to say thank you for listening. I hope that this episode at least taught you something.
Something.
That's what we're here for. Spread awareness, educate people however they can be educated and stuff like that. And I just want to give you special thank you
Thank you for having me.
for coming. You were really
Educated today?
Yeah. No, there are things you taught me
the
today
way
I
I
didn't know.
came and met them come. And
You understood. We were in it.
You know we're in it because we're really mistaken. You know what I'm
You see
saying?
this way she said, please tell my sister, like this me I know her now. Every 2 days she stand in front.
She'll text our group chat, be like, did you guys check your breast?
The way she was trying to tell me, now she'll be like, Hannah, feed it.
What?
I know.
But yeah, y'all. Thank you guys
doing
for
that.
tuning in to another episode of Hot in the City. Mwah. Love you guys. See ya. Bro.